join Dr. Lawrence Rosansky from Cooper Heart Institute and Kathy McKeever from Advocare Surgical Specialist
We're Will
on the
Simon's
importance
office,
of a
and
cardiac
today I'm
clearance
going to ask you a
prior
few
to
questions that our
bariatric
patients
surgery.
might want to know before they proceed with bariatric surgery. And number one is, why do our surgical patients need to see a cardiologist?
Well, Kathy, a lot of the bariatric patients, because of their size and bariatric needs, have a lot of risk factors for heart disease. They include high blood pressure in many cases, high cholesterol, and sometimes even sugar diabetes. And all of those risk factors put the patients at risk for heart disease that you would obviously want to know about before the operation rather than during or after the operation.
Yeah, definitely. Okay, so if I was to send them to you, what would happen at their first visit?
Well, the first visit would be the same as any kind of a cardiology visit. It would include a multitude of questions about general health as well as their cardiac health, a complete thorough physical exam focusing not only on the entire body but the heart in particular, and then based on the results of the examination and the inquisition, we would proceed with testing as needed.
Okay.
Some folks do need testing. Some folks are healthy enough to get by with none.
Well, that's a good thing, right?
For some it is, yeah.
Yeah. And why would you order a stress test or an echo? What would make you order that? If you found an abnormal EKG or you just
Right. An abnormal EKG would be one big tip-off because in the age range that we see from your office for the most part, these should be healthy individuals in general.
right?
So if the EKG is off, that's clearly a tip-off that something's amiss and it
Right.
needs further investigation. If there are signs by physical exam or symptoms that the patients report to us that we would want to investigate, we may want to do a stress test to check for any kind of coronary disease. We may want to proceed with an ultrasound of the heart, or what we call an echocardiogram, that would determine the strength of the heart muscle function, the valvular function, if there's any heart murmurs that the doctors detect, to have these things evaluated prior to surgery rather than after surgery.
And then what would happen if they weren't physically able to do a stress test? What would you order?
Well, it's interesting. When I was training, it would be a very difficult situation. Nowadays, we have chemical stress tests.
Oh.
Now, there are stress tests that we can do that don't require physical activity but are done with a chemical. And the doctor would administer a chemical to you in lieu of a treadmill stress test that would put a chemical stress on your heart and allow us to determine whether or not the heart has the suitability to go through an operation or not.
Wow, that's amazing.
Yeah.
Yeah, that
Come a long way.
they really have. Yeah. And my last question to you is, what is a cardiologist? So tell me all about you.
Well, I think you already know that answer. A cardiologist is a heart specialist, and basically we're a general internal medicine type doctor, but we do additional training. Every cardiologist has at least an additional 3 years of training after medical school, which is 4 years, after a residency, which is another 3 years, and then on top of that, another 3 years, if not more, of training specifically in cardiovascular disease. So what happens with most cardiologists is that they focus primarily on the heart and sort of put their medical practice to the side because the heart is really a full-time business these days.
Yes. Thank you so much for taking this time to enlighten our patients of what a
Absolutely.
cardiologist does.
It's my pleasure. Thanks for
All
coming
right,
over.
Thank you. All right.